22-year-old female with constant bags. Which procedure is needed? I am 22 years old, and since my senior year of high school, I have had trouble with my eye bags. But now that I am 23, I am so unhappy with my eyes that I rarely enjoy social interactions. I have gone to an allergist, who then told me to go to an ENT doctor, who said there is nothing I can do about my eye bags, and that I needed plastic surgery. So I was wondering, what will help me? I am not sure whether I need a blepharoplasty or fillers to help with my eyes, but I am ready to do whatever necessary.
Thank you for your question. You're 23 years old and you're describing a situation where you have puffiness under your eyes since your senior year of high school, and you've pursued medical therapy such as seeing your ear, nose, throat doctor, who ultimately recommended to you that you need some type of cosmetic procedure. And you're asking whether or not to do surgery versus a filler. So I'll share with you our approach. I appreciate the photos you've submitted, and I'll give you a perspective as to how you can make a decision. I'm a cosmetic oculofacial plastic surgeon. That means that I had original training first in eye surgery before doing specialized training in cosmetic surgery of the eyes. And in the world of plastic surgery and cosmetic surgery, people like me are the ones who often deal with the complex problems and as well as the not so complex problems as have come in terms of the eyes. I'm practicing for over 20 years, and what I've seen is an evolution in our options for how to help people with bags under their eyes. When you describe the fillers, what you're describing is a filler such as a hyaluronic acid filler, such as Restylane. And what determines whether or not you're a good candidate in our practice is about how puffy the bags are. There's a common misconception that under eye bags can be camouflaged and you can avoid surgery altogether. That couldn't be further from the truth. The number of patients we see in our practice who have had too much filler placed in under their eyes and in their cheeks to try to camouflage their bags is incredible. I think that a good option for a limited amount of puffiness is getting used, and I think particularly by non-surgeons, people who can't do cosmetic eyelid surgery. So they position themselves in a way to say that, well, they're saving you from surgery, but we spend a lot of time dissolving these materials. So just to understand in your situation, because you submitted photos, there is no true three-dimensionality to how I can make this recommendation. But I would suspect with your photos that your puffy bags may benefit with some degree of filler, but it might be an option for you to first try the filler and see if it gives you the result that you desire. Now, the negative of a filler is that you have to continue to have it done. On the other side of that would be a more definitive procedure. For a young person with puffy bags under the eyes, and the youngest patient we've ever operated on was 14, so certainly you're not too young from that perspective, and we would do something called a transconjunctival blepharoplasty. What that means is I address the fat pockets from the inside of the eyelids, and by reducing the amount that is pushing forward, we refer to the term as herniated fat. Just to quickly orient you, the puffiness is caused by fat pockets. These fat pockets are normally around the eyes and usually from a genetic factor come forward and create this bulge appearance. So what we do in surgery is under local anesthesia with a little bit of intravenous sedation. Very often younger people like yourself are really hesitant and scared about doing surgery, so the sedation helps make that easier. You're not under general anesthesia, and we address the fat pockets under the eyes with the use of lasers and radiofrequency technology. By doing that, I suspect you'll probably be able to put that behind you and not worry about maintenance. I think that in the balance, if the puffiness is beyond a certain threshold, surgery is the way to go. Again, understanding that there are patients like you who come to our practice and they're so afraid of surgery that they really want me to try. And I'm willing to try by doing a conservative amount of filler to see if I can soften the transition. Some people find that acceptable. A lot of people feel like they should go ahead with the surgery. So I think it's important that you meet with cosmetic surgeons, and I stress the word surgeons because surgeons can do both surgery and injectables as opposed to non-surgeons who can only do injectables, and learn about your options. And I suspect with a couple of consultations, you'll get the sense of what the right thing to do is. And once you feel comfortable, move forward with the solution that best suits you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.